How are we feeling? Are we excited?
I am excited. Yeah, I think it's an interesting opportunity that like I've never been a part of before, and I feel like podcasts are so like new age, even though they're not really new age. I can remember having an iPod like back in like the little like the touchscreen ones, and podcast was always like an option on it, and I was like, who listens to podcasts? But now as an adult, they're like, yeah, like a new age thing that a lot of people are really into, so it's cool to be a part of one.
Yeah, no, I'm excited to have you here. It's kind of my thing. I had one before I worked here. I'm excited to be doing it as a full-time job. I was sort of like on the cusp of that, and then lots of things. I mean, you know, where you both work, I say arena a lot. Mel Robbins Mel Robbins doesn't say that. It's Brene Brown who always talks about the arena, right? Mm-hmm. Being in the arena. And I think that sort of embodies what we're talking about today, because we want to talk a lot about CYS and a lot of stigma behind that. And you are both in the arena, so you're doing the work, so you understand how that goes. Hello, and welcome to this season of Alter Ego. I am your host, Laura Krigo. Let's keep the conversation going. Now a word from our sponsor, BetterHelp. BetterHelp is a platform that makes finding a therapist easier because it's online. Remote therapy sessions, and by filling out a few questions, BetterHelp can match you to a professional therapist in as little as a few days. It's easy to sign up and get matched with a therapist. Click the link in description and receive 10% off your first month of BetterHelp. And by clicking that link, you support this channel. Plus, you can easily switch to a new therapist at no additional cost without stressing about insurance, who's in your network, or anything like that. I was struggling for a long time, and BetterHelp was where I found my therapist, Whitney, who I still see weekly for almost 2 years now. So, if you're struggling like I was, consider online therapy with BetterHelp. Click the link in description or go to betterhelp.com/alter ego. That's better, HELP.com/alter ego. There's no better time than now to start your mental health journey. Thank you again, BetterHelp, for supporting this channel. Joining me today, Samantha Morris, sitting directly to my right, your left, is the foster care recruitment and retention specialist at Family Pathways in Butler County. She works with families one-on-one who are looking to become certified licensed foster caregivers in the state of Pennsylvania. This entails following guidelines set forth by state regulations and child protective service laws while guiding families through the process. You may also see her in the community or at local events in order to gain public interest in Family Pathways foster care program. She runs the Family Pathways Facebook page and heads many of the events hosted by the Agency for Families, Children, and the Community. Samantha attended the University of Pennsylvania, Indiana University of Pennsylvania, IUP, for psychology, and has a history working in the criminal justice and juvenile dependency systems. Samantha, welcome.
Thank you. Thanks for having us.
Yes, of course. Next to Samantha is Hannah Rausch, is the placement specialist at Family Pathways. Hannah studied psychology with a concentration in applied psychology and a minor in child development and family relations. She has been working at Family Pathways since March of 2023, so we're coming up on an anniversary. Mm-hmm. Hannah began as a placement and permanency facilitator who managed cases focusing on the safety and well-being of children, provided SWAN services, which we will get into, and assisted kinship and foster families through the formal foster care certification process. Over the last year, Hannah has been transitioning into the role of placement specialist, developing management and leadership skills, and assisting with program development. Hannah, welcome. Ladies, welcome. Everybody gets, at some point, the applause button, and it just felt natural to do it right then. I met these two young ladies. Samantha actually reached out to me.
I did via Instagram.
Which I love because I tell people all the time, So had you listened to the podcast or had you heard of it or what? I never asked you this question.
So I do have to admit, my coworker who joined our recruitment team more recently, she was like, why are we not doing podcasts? And she immediately following the meeting went and researched podcasts in Butler. And this was one of the ones that she had like mentioned. And she was like, I think you should reach out. I think it'll be great. And so like definitely like shout out to her for that. I found you on Instagram first and I thought, well, I'll just reach out and see what she says. And it ended up working out.
Yeah, it did.
Well. Yeah.
I really like when people reach out. I know that when we first met, I was sort of, you always have a plan, right? I had a plan. This is what I'm going to do. I'm going to start having these conversations. And for the most part, since I started the podcast, it was a year in February. It's gone that way. But then more recently, it's like I've had people reaching out and then it's kind of shifts me down these paths, which we had that conversation a little bit. Because when I asked you both about your why, why you work in a field, and I feel like everyone I've talked to works in these really difficult fields. I mean, you have probably a lot of reward in what you do too, because there have to be stories that, really give you a lot of all the good feels, but it's not easy what you do either, because you are also dealing with children and you're dealing with people who could be going through some of the hardest times in their lives. And, we will talk about reintegration and all the different aspects to what you do. But I want to start with both of you and what brought you into this work. What was it that got you started in that and how you ended up where you are today?
I actually kind of think me not having a degree puts me in a very interesting journey into this field, because most people kind of follow a very streamlined process to get here. But mine kind of just looks a lot different than most of the people around me. And sometimes it makes me, feel, I don't want to say insecure, but then whenever I think about all of the things that I've done to help families and how hard I have worked to get here, then I try to remember who I actually am. Mm-hmm. But no, it's funny. I actually started out as a retail worker. And when I started working in retail, I then got a job at Lowe's, and that was retail, but I was working in their shipping and receiving department. Mm-hmm. So then I had office experience, and office experience got me a job at a law firm. And then a job at a law firm as a legal assistant got me a job as a paralegal in the child welfare system. And I think that's where most of my knowledge and then also my why started, because that was just so much more directly in everything. And from there, I've just been able to move to a much more hands-on in the field position, which is kind of what I wanted. But I think that it's so important to learn a lot of the ins and outs of the system. So I think that's where being a paralegal has really helped me. But yeah, so my journey just looks different, and it comes from, hey, this opportunity is out there and it pays better, so why don't we try this? And I'm like, all right, I'll go for it. And I go for it, and I'm like, wow, I got it. And that's kind of happened more than once for me. So I feel very fortunate to be where I am, because not a lot of people can say oh, I didn't, finish my education to end up where I'm at in this field. But experience is what got me there, and yeah, I'm thankful for that.
That's a good message, because I often think that, we feel like we have to do this. Mm-hmm. We were talking in the beginning, it's should have done this or should do this. And I feel as if my generation as well, and you're both probably 2 decades younger than me, I believe, yes. You're both in your late 20s?
Oh, I'm 30.
Okay.
25.
Okay,
yeah.
So you're just 30, right?
Yeah, well, I'll be 30 in the end of July. So.
Okay.
31, sorry.
No, don't be sorry. Don't be sorry at all. That's where you both are. It's such a good place, because you're really starting to realize who you are as a person and be like, I am an adult now. I am doing adult things. But it's a good message to give someone, because a lot of times there is that pressure to feel like you have to go to college and you have to get a degree and you have to graduate, and not knocking any of that. I always think that we should always be learning, even that's just taking classes or courses or online degrees. There's so many different opportunities right now. So I love that. And it goes to the tune of you're going to end up where you're meant to be. So I think that's what absolutely happened with you.
Yeah.
And you had said, you're like, I wasn't looking to do this. You just ended up there.
Yeah, for sure. And I think that these types of positions, not just positions, but these types of agencies and whatnot, like it's good to have perspective from a lot of different angles. So everyone is needed.
Absolutely. Hannah, talk to us. Tell us how you got here.
I didn't really plan to end up in this field, but I'm happy that I did. I think I can see myself working in this field for a long time, but I just loved my psychology class in high school, so I decided that's what I wanted to study at IUP. And I don't know. I took the child development courses for my minor, and I discovered that I like working with children more than I thought that I might. And here I am.
Yeah, here you are. Well, welcome, both of you. I'm just really excited to have you here because I think I was talking to you a little bit about my brain is at a place where I'm like, do I want to be a foster parent? Do I not want to be a foster parent? And then you literally sent me this email, and I was like, this is kind of weird.
You should do it.
Do you want to be?
We're always looking.
So I have to tell you, so I went to your website, and I did see there were a couple kids that were on there. And I saw their pictures, and I started crying. Yeah. And it makes me sad when I see kids who are looking for a home.
Yeah.
Whatever, and I know they're all, right, there's different layers to every story, right? Because we are going to get into all of the layers. So, your number one goal for children is reunification, right?
Correct.
And that is, you guys you do everything that you can to reunify this child or children, siblings oftentimes, back to their families, to their parents. Yeah. Get the parents the help that they need. And that's what we want. And that's also, there's a stigma behind that as well. There's so much judgment. And I do feel like there's more conversation behind changing judgment, regardless of what it is, whether we're talking about substance or anything. And a lot of times there is substances involved in these situations, but getting the child adopted or, permanent legal or a custody order is second. And that's like absolutely if you cannot reunify that child.
Yeah.
And that's something people need to understand, because I do think that there is that stigma. And when we get into CYS, talking about that. But when I looked at these kids, I was like, oh.
Yeah.
You talk about how you provide so many resources for foster parents, and there's a lot that has to happen in order. It's not like you're just like, hey, you want to be a foster parent? All right, fill out this piece of paper and here you go. There's a lot that has to happen. So what would be, let's just say, if I said yes, one thing I do know, and I think you did confirm this with me, is in order to foster, I would need to have a bedroom for that child. Like, I currently have a 1-bedroom home. So I already know in my brain, I'm like, I have to move. So I have to move and get a 2-bedroom. I do know that.
Yeah, I mean, for the most part, yes, that they do need to have like adequate space, a place to sleep, a place to store their clothing and things like that. I mean, I think some people who are like in kinship situations make it work a little differently. Like everyone's lives look different. And especially whenever we're trying to like preserve that family unit, whenever kids go with their relatives, our goal is to, again, like preserve that. So if their situation is a little different, then we usually do what we can to like make that work. Yeah. But as far as like traditional foster care, I would say unless it's like an infant, they would need their own space.
Yeah. And that's what I assumed. I said, well, if they had an infant, but it's not like you're just going to get an infant. Right. You're not just going to get.
Yeah, no, it doesn't happen that way very often. It does sometimes, but not very often.
That's the knowledge. That's what I know. Now, is there and I know I believe for adopting, I've heard that there is an age cutoff. And I don't know if that's true or not. And I don't know if that was like fear mongering someone was doing to me, but they had a friend who was, I believe she was 47 and wanted to adopt a baby. And she wasn't eligible because they were looking at here's a baby, here's a newborn baby, and you're 47. So by the time the child reaches their teenage years, you're going to be in your 60s, which there's a lot of parents in their 60s out there.
Yeah.
So I don't know if that was true. I don't know if that's on a state-by-state basis. But so say someone wants to foster. They come into your facility. Do you want to just go through what are the steps that have to happen in order for that to be possible?
Yeah.
The certification process is the same for kinship and foster families. They have the same trainings, the same clearances, all the policy paperwork, all of that's exactly the same. So we typically like to start with a home visit where we go out to their home so that we can make sure we're even able to certify, go through all of the basic safety concerns. We do a home study, which sounds a little bit scarier than it might be, but we look for like smoke detectors, fire extinguishers, the child having appropriate sleeping arrangements, and all of those things can be addressed. It's not like if you don't have smoke detectors that day, we're not going to certify you, but we help with that stuff, and then we would go through all of our policy paperwork and clearances, get started on those applications, and then a foster parent would be provided with 12 hours worth of certification trainings, and that covers the hours that you need for like your year certification, but we continue providing those trainings throughout the year as well to make sure we're helping everyone out as much as we can.
Yeah, that was literally my next question was how often are you sort of checking in with these foster parents? I mean, is there like a check-in that they have to abide by?
Yeah. Our facilitators that are assigned to the children in the home, they have to check in with their caregivers once a week and then also make like a monthly visit. And whenever a child goes into a home, our agency has like a regulation of 10 days to like see the child. So, I mean, we're kind of always on timelines.
Yeah.
So, but yeah, no, they're doing weekly check-ins. And honestly, I will say, I feel like it's often just more than that. Because like we're kind of a big support to our families and the kids in their home. And I think it also allows CYS to kind of do a lot of the work whenever we're assisting on like the front line with them. So, but also to like circle back and answer your question about age, like ages or anything like that. We have so many grandparents who are caregivers, and I've never, I mean, at least for us and the counties we work with, we've never questioned like age as a factor. I mean, I think if like significant health concerns came into the picture, we would have to look at it more like, are you able to genuinely meet the needs of a child? But like, oh my goodness, I would say like almost all of our kinship care providers are grandparents, and they're great.
Yeah, I do hear that often. In our family, we sort of had a situation, excuse me, like that. And it's just something that I think that people need to understand what they're capable of doing for children in this community, even families who already have kids, right? Who have raised children.
Yeah.
You know, Dr. Lewis, she was on the last episode, and this is something she's dedicated her whole life to, working in this field. And she's fostered. I think she's had 2 different situations where she fostered. I know once she had twins, right?
Yeah.
And they were just dropped off at the end of her driveway, which she laughs at. And I'm like,
changed.
were you laughing when that happened, though? I mean, you just saw 2 kids walking down your driveway, but they knew, obviously, that she wasn't going to turn them away, and that was a different situation. So that's not going to happen to anybody. They're not going to.
Very different times now. Yeah.
and it's probably different on a case-by-case basis. And I know some of these questions I'm just going to throw at you, but how long typically does it take, you know, once you start vetting someone? I mean, when you say clearances, I mean, you're probably going through
FBI, child abuse, criminal, all of that. But
I actually just did all of those clearances for this event that we have to
do.
Yeah. I went through all of those. And it's funny because it asks for all of your addresses since 1975. And I was born in 1980. And I was like, I've lived in 7 states. And I was like, how long is this going to take me a while?
Yeah, imagine being the person asking you to do that.
Right.
So, yeah, that's what I was going to say. As I was sitting there, I'm like, someone has to check this.
Yeah. That's like, we run that clearance. So the whole way back to 1975. But then we run kind of like an internal clearance. And then it kind of it spans back like the last 10 years. And it also spans back to like other states you've lived in. So we're obtaining clearance information, not just from Pennsylvania, from like any residence that like state of residence that these individuals have lived in. And we have to kind of clear everything with like their internal like DFS systems or CPS systems, or every state's different. So, you know.
It sounds like it's not like an easy task to become a certified caregiver, but it sounds and looks paper wise like it's a lot more, and it's really intimidating to people, but we really do our best. And I think the facilitators do a good job trying to support where we can. Like, we try to make it easy by you just fill out the clearance application and turn it back into us, and then we'll get you scheduled for your appointment. All you have to do is show up. So we really try to make it easy. We have people come into our office if they need help working through trainings, and we don't just drop it off and let people figure it out on their own.
We do try really hard to like guide people through the process to make it easier. Definitely not as easy as it seems, but not as intimidating as it seems either. It's kind of actually somewhere in the middle. And once it's done, it's not as daunting every year after that. Some things like obviously have to be redone annually, some things biannually, you know, whatever the policy is. But once you're certified, you can kind of stay on that like recertification cycle, and it just kind of like limits the amount of things you have to do per year, because you've already met that initial certification. So that's kind of nice.
And that was the next one too, like how often. So it's annually. Okay.
And you asked how long it takes. Whenever we get a referral, which is typically kinship instead of somebody just signing up to foster and accepting a placement, if we get a referral and a child's placed with a family member and our agency is asked to certify them, they have 60 days to complete the certification, or else they like fall outside of their timeline. But more often than not, people meet it unless there's an issue with like clearances or something like that. But 60 days, most people are able to get it done.
Yeah.
And then we can usually apply that timeline whenever people are just genuinely interested in being a foster caregiver. A lot of times they do ask me like, how long does this process take? We kind of let them know, like, you know, it's kind of up to you depending on how quickly you're able to get things done, but we give them that typical timeline of 60 days. And a lot of them are able to kind of fall within that. We have, you know, some stragglers here and there, but that's all right.
Like, you can make it take as long as you want it to if you're signing up to be a foster parent, but it's possible to get it done in less than 60 days. Yeah.
So a random question that popped in my head too was, so the children that you have currently that you're trying to place, where are they right now? Are you allowed to, and I don't mean them specifically, I mean, when you have a child that you're trying to place, are they in an orphanage? Are they with family? Are they still in their current situation? Is that something you're allowed to talk about? And if you're not, it's totally fine. It's a thing in my brain. I think like, oh, they're in an orphanage or something. They're all in one home.
Right. We don't necessarily like have these children, but we get calls from various counties close by, and they might be like detaining that child later that week. They know that they're going to be detaining that child at the next court hearing, maybe even that day. But a lot of the times it's if they're being like removed from their home, or if they were in a previous placement that didn't work out. And we have some children who are in like inpatient or in residential facilities.
Or they're in like a respite home, which is still a certified caregiver, but they provide like short-term care versus long-term. But yeah, I don't think that they're, based off of my understanding, I don't think there are any orphanages left in the United States.
Okay. That was
my understanding too.
Okay. Because that was literally a question. I was like, I don't know if there are.
There was like regulations that have taken over that's no longer an option for kids. And honestly, like, the goal is to not even really like terminate like parental rights until there is a plan in place. Obviously that doesn't always happen that way because sometimes things go awry, but the goal is to always have a permanent option for children whenever the idea of terminating parental rights takes place, so that they're not creating what is called like an orphan of the state, which I think is probably the closest to that older, like more old school idea of orphanages. But Even now, like whenever you have more than like 6 children in a home, there's a lot of paperwork that has to be done. It's definitely not like it used to be.
Yeah, there's waivers for everything.
I'm sure. And it has to be, you are, when they're going through you, then they're technically in your custody, right?
They would be in custody of like the county that we
of the county. And so, when someone's fostering a child, it's not like they can just be like, oh, I'm going to take this kid to California for, there's so many things that you guys are constantly just following along and making sure it's like all the rules. That's,
I mean, traditionally, and this is kind of unfortunate, but it's kind of a real part of the foster care system. Usually children end up sleeping, at an agency with a caseworker or 2 caseworkers or however many people they have like on call until they're able to find placement. Like kids stay at an agency until that's able to be like secured or located. And usually they're just calling everywhere that they know, and then that's us, and then we're calling everyone we know. And it's kind of interesting how it starts with like one entity, so that being CYS, and then they make all these calls, and then everyone makes all those calls on top of that, and it kind of like just branches out to be something like a lot more expansive than what you can really imagine.
And when you're first getting a child into this process, you have so many resources that you provide, especially to them and the families, to essentially explain to them, like, this is what's happening and this is our goal. Obviously we've talked a little bit about, I haven't really gotten into reunification. So what can you share when it comes to reunification when you first have a child, who comes through your system, through your program, through your, I'm saying all the words, right?
Yeah.
Because sometimes I don't like saying system, right? Because it feels so legal and so just impersonal, but we're talking about human beings. We're talking about children.
Yeah.
So, and I know for all of you, it is probably something that's constantly just, again, I have to commend both of you, especially for being as young as you are, and you are young, even though I know you're turning 31. I remember when I turned 30 and I had a moment where I was like, I'm turning 30. And I was like, yes. And then I was like, oh, I'm 30. I was like, oh my gosh, I'm 30. Like, I feel like things are supposed to be happening, right?
Yeah.
You start to feel that
pressure.
You start to feel pressure of things. But just talk about that a little bit and how, how that goes. If you bring a child in and you have to have these conversations with them and what that process sort of looks like, and explaining to them as much as you can, like, hey, our goal is to.
Yeah. I mean, I think we talk about that a lot during the certification process. We do ask a lot of questions that are about like, supporting biological families, supporting partnership with family pathways, partnership with CYS agencies, following court orders, anything like that. And we definitely stress the idea that reunification is always the goal until it isn't. And I still think that, regardless of whether we, call it whatever, our first initial training for our families is called How the System Works. And I think it's like a great basic, outline of everything, but there's so many variables that take place. And then also every family dynamic is different. Every county operates a little bit differently. So it's kind of interesting to see how that, but like, we're like learning constantly as we're also helping families learn. So yeah, it's definitely, getting people to be on that, same page of like reunification it can be not difficult, but sometimes people don't understand it. And then I think as they work through the process, they start to see why it's important more. So, and then sometimes it just, isn't in the best interest of the child. And then that's whenever, the court makes that decision. And I think that's another really important thing for people to understand is, at the end of the day, almost all decisions come down to a judge. So,
yeah. And, we had talked a little bit about the stigma behind CYS.
Yeah.
Do you guys want to hit some of those points and what a lot of people, like fact versus fiction, essentially?
Yeah. I mean, at my last job, I know Charlie from CYS came over and did a training about how they were trying to change the way that they're perceived, I guess, or they have been working on doing that for a while now. And I think that they have done that. And people might see CYS as like, oh, they're just taking my kids. People believe all kinds of crazy things that happen at CYS, but they are there to make sure that child is safe, and they want to provide the resources for the parents. They don't want more children in foster care. They don't want more visits to go out and see difficult situations. So I think that people starting to realize that CYS shouldn't be viewed as the bad guys all the time. They're really just there to help the children and the families get what they need.
And they're doing their jobs.
Yeah.
Yeah. I mean, I think a big thing now too is first, I think a lot of like newer regulations are very family first forward. So I know agencies have started utilizing what's called a safety plan a lot. And it's kind of, I don't want to like misspeak on exactly what it is, but it's like a plan put into place so that they can exhaust all of their reasonable efforts to not remove a child from the home. And sometimes that allows like family members or family friends, which can still be considered kinship, are able to help them out during a time period while that safety plan is in place to get those things taken care of so that they don't have to file for custody of a child. So that's kind of part of it. But also there's a lot of really great resources that are just kind of popping up and growing to get into, people's homes to help, stabilize them and really provide care to them before they have to take that action. I mean, being proactive is something I think that's more common now than it ever has been in child welfare. And I definitely think that people can be very on the defense whenever they first want to come in and help you, because they automatically think like, oh, if I screw up or if I don't do what I'm supposed to, this could lead to them taking my children. And I actually just don't want them in my home or, things like that. And I definitely can understand that. But I think at the end of the day, if a report comes in, they have an obligation to investigate it. And that is just their job. That is just their duty as, either whether it's an intake worker or not, they have to do it. And it really sucks, but it's just kind of the situation that they're in. And I mean, people can be involved with CYS without their kids being removed. They can be open for services. So it's like a lot lower level of, I don't want to say care, because the care is still the same. It's just the level of involvement is a little different. And I think that's usually how they try to start out cases. Obviously, there are factors that will like rise to the level of neglect or abuse, and that they just can't ignore those things. But I would say for the most part, they try really hard to keep families intact.
So we talked a little bit about SWAN last time, and my notes says statewide adoption network. And then I also have grants written here too, because that's how my writing goes.
Yeah.
I just scribbled all together, and you can correct me, Hannah, if I'm wrong on this, but it's, recruitment, retention, you have community events, which we have community events coming up here in May.
Yeah.
And April is Child Abuse Prevention Month, and May is Foster Care Awareness Month. So that's why it's important for these episodes to be coming out. So let me backtrack and go back to SWAN. Do you want to maybe touch on that a little bit more
I think
eloquently?
Sam actually does a lot better job explaining SWAN
yeah,
services.
let's go to Sam. Yeah.
So we, like a lot of agencies are what's considered like a SWAN affiliate agency, and they have multiple types of services. They're called units of service, and they allow our agency workers to administer these services to children and families that are like in the homes. A big part of SWAN services are for children who are in the system and they are needing some assistance with like understanding their permanency journey. That's a big part of one of them. Also just kind of creating documents about the child as best as we can, so that as things take place, like the court is aware of kind of what's going on. If they were to ever move placements or move toward adoption or anything like that, like these documents exist to, you know, be able to help bring insight on, you know, their health history, where they went to school, you know, what their grades were like, who all they've lived with, is there any history of disease in their family, things like that. Like that breaks down a lot of that information. And then there's also services to help match like older youth with families, because sometimes those are the kids who are like waiting, who maybe have had termination of their parents happen or some other situation. And they are now just like waiting for a family to go through that like matching process. And then we also do like finalization services, post-permanency services. So we help families who have adopted and they still need resources, because sometimes those resources aren't there once adoption takes place. And then we do like the child-specific recruitment services, which are, you know, just trying to match a child to a family, you know, who, again, is waiting. There's a couple different services like that. And then we also do what's called the family profile. And that's just like a legal document that's required for adoption, typically. And it can be used in two different settings. One, it can be for a family that's like ready to adopt. They've done the whole thing. They're waiting. The child is in their home. They've taken on that role, and they need this document written in order to adopt. And then there's also like what's called matching families. And they don't have in mind what they're necessarily looking for, but they want to start the process. So we'll write what's called a family profile on them, and then they can participate in matching events or our reverse matching events with like children and vice versa, to view, you know, kind of what's going on with the family, or do they have a dynamic that they would like? Do they have pets? Is there siblings? You know, two-parent household, those kind of things, to try to create matches for those kids that are waiting as well. So there's a lot, I mean, there's a lot that goes into it. That's truly just like a tiny little snippet of it.
Yeah.
But
yeah, I'm sure. You know, I was thinking the other day too, is when these kids are being placed, how often are they having to switch schools?
yeah,
And how does that also add a level of difficulty? Because not only are you moving a child, and not because you want to, right, but because you're in the best interest of the child. And obviously having, you know, whether it's kinship, whether you have like grandparents are like, we can take the child, we can absolutely do this, and that works, but then they're changing school districts again, or how do you navigate all that? And you have so many support systems. So in a situation like that, how much more difficulty does that add? Essentially is the question I'm asking you. And what do you do in order to provide those added resources? Sorry. I'm literally just throwing questions at you.
That's
both.
okay.
So, and you're
we
doing
just want to
wonderful.
equally answer.
Yeah.
I mean, in regards to school, most of the time, more often than not, there's a bid meeting, a best interest determinations meeting to determine the best interest of the child. And if they're coming from a county that's like a few hours away, it might be in their best interest to move schools to a location closer to their foster home. But then again, it could be in their best interest to remain where they are because they've been there their whole childhood. So it just kind of depends on the situation, but the best interest of the child is always the center for everything changing. I mean, I attended a training with my supervisor when I first started at Family Pathways that talks about all of the different types of loss that children experience coming into care, and it can be from physical things to just being removed from your home is a loss in itself for that child. So there's lots of layers to
I'm sure.
everything.
I'm sure. And then, you know, we've talked a little about siblings. You do try to keep siblings together.
Yeah.
So the difficulty there is obviously finding a home where they can all go.
Yeah. I think a big part of that is just families' actual like capacity to have like that many children in their home. Obviously we love whenever someone is like, yeah, we can take the whole sibling group, and that's great, but that is not always realistic. And the goal is to, if that's the case, like at least keep some of them together. If we do have to split the family unit, and then if that is not able to happen, usually what I've seen is CYS will either, not CYS, but a judge will either court order, or CYS will facilitate sibling visits, hopefully on like a weekly basis between them to keep that, you know, intact. Whenever the agency reports to the court on like a 3 or 5 or 6 month basis, if they have siblings in care, they have to report on whether they're seeing each other or not, and how often that is and what that looks like. So there is definitely an importance like emphasized on the sibling unit and keeping that intact. But it's not easy.
Even babies, like I've had children on my caseload who the mom has another child and they still want that child to be placed with the siblings if they have to remove them, obviously. But yeah, it's last resort to separate siblings.
Yeah.
So a lot of things to check off on that number one list there. You've got reunification, you have keeping kids in the best, what was it called? BID?
Yes, best interest determination.
Best interest determination. You have siblings oftentimes. So I did ask you for any like statistics that you might have to bring today. Do you want to tell me what you...
Yeah, so I actually brought some statistics from the Children's Bureau and the Child Welfare Info Gateway. They actually, at least from my understanding, annually, they put out like a media toolkit for agencies to use statistics. At least the one we used was in November for National Adoption Month. So we were able to kind of create some social media posts for like awareness and like graphics and things like that. So I actually just pulled some information from there because it's, I think, as relevant as we can get for an annual basis. But on average, there is 109,000 children in the United States waiting for permanent placement homes, which I know doesn't sound like a lot as far as like compared to billions of people, but in reality, that's not, I don't think that includes like children who are in care. I think that those are children who are like actually waiting for a permanent placement, which is a lot then if you think about it like that.
Yeah. Sorry, that actually made me a little...
It is a big number.
Yeah, and a quarter of those children waiting for permanent homes are teenagers. If we're gonna talk about stigma, I think that's a big one. A lot of people are really, really hesitant to accept placement of teens, and I don't want to say I don't necessarily blame them, because a lot of times they have young children and they're trying really hard to do the right thing for not only a child who needs it, but the kids who live in their home currently, like their natural children. And we definitely don't, blame people for that. We understand. But at the same time, sometimes teenagers are, just they have a past, but they've, I think, been like labeled in a way that's not accurately depicting who they are.
You can't really blame them either for perhaps coming into a new situation and maybe naturally having a teenager's attitude, which we've all been teenagers, right? And that a lot of that's based around hormones, things that we don't know how to control, don't know how to understand yet. When we talk about, if we're going to get into, the way our brains developed and that our frontal lobe isn't fully developed. So we don't have that way of reasoning and understanding conflict. And yet most of their entire lives have probably been conflict because of this situation, depending on when they were removed either from a home or how many times they've had to be put in different situations because of all the factors that you just listed.
Yeah.
How often are those kids in a situation where they're able to meet possible families? Or, you talked a little bit about these events, and do you guys ever have the kids at events like that, or is that something that's totally separate?
We did a reverse matching event, I believe, at least yearly. I've never been to a matching event, but the reverse matching events I think are really great because it gives the child like the voice, I guess, to go view these families. The families aren't there. They get to read through like pamphlets about them, see pictures of their family, their pets, their interests, and they can be like, oh, I would be interested in that family rather than the other way around.
Yeah.
So that was really nice. It was held at a church in Cranberry, and they had like a little mini golf course, so it was fun for them. They provided school supplies and new backpacks and food, so that was really nice to attend.
Yeah.
Yeah, and I think it's important to say that the kids who are waiting, they all have county caseworkers, and then most of the time they all have like an affiliate agency worker, so someone like from Family Pathways. I mean, we have a permanency specialist who does a lot of that work, and she's like training some other staff right now to learn how to do that as well. And they essentially, like, the service for that child, it's like it'll get referred by the county, and then they will do their best to try to find like matches and potential families for those children.
Yeah.
So there's like somebody always working toward it. You know, it's kind of like an intricate system, like, you know, we talk about that, but like with a lot of layers. But it is interesting to know how many people really are trying to make it happen.
What do you think I could say to people who have never even thought about it, right? But have the resources, like have the home, have raised children, and possibly just never recognized or realized, I should say, that that's a big number.
Yeah.
We get calls frequently looking for homes for children, and I think that older children, it's the most difficult to find homes for, but the expectations of being a foster parent might be different in somebody's head than they are in the reality of fostering. I think that if somebody is interested in doing this, I know it's not an easy decision. It's not something that you can just wake up one day and be like, yeah, okay, I'm ready to do this. But I think that it's important to know that we really try to do our best to support people through this process and keep in mind what's best for not only their family, but also the child. We wouldn't set a child up to go into a home that we don't think would work out for them. If it's not what's best for the family, it's not going to work out for the child. So they have all of our support through the whole process.
Absolutely. And it is one of those things where any change, right, to your life, any drastic change, for me, my brain immediately goes, am I enough as a single woman?
Yeah.
That's my first thing.
We have single mothers.
Oh, yeah.
Yep.
Yeah.
And am I going to be able to navigate, you know, and you provide so many resources, right, and so much training, but am I going to be able to navigate whenever something comes up? And I think that I'm in a place in my life where I already know things from my childhood that I'm like, no, it's not. I'm more of a, I'm not into the shouting, not into the paddling, none of that stuff. I'm more into I know consequences work. It's like, okay, well then you're not going to be able to watch your show.
Yeah.
And here's why, but also treating them like a person. I think a lot of times kids, you know, after a certain point, it's like they can't help that they're a kid, right? They can't help that they're, or a teenager, right? They can't help that they're 13 or 14 as they've been put into these situations. So it's also a little bit of empathy can go a long way, I think, in understanding like, hey, this is scary for me too.
Yeah. So I think,
you know, how do you, I mean, those are all the things that are kind of going through my brain. Like, I'm kind of like, how am I I want to be able to discipline, even though I'm only a foster parent, you know, and we did bring that up. You did bring that up because it's like, especially if they just came out of a home, right? And this is what they've been used to. As humans, we're creatures of habit. So once we get into habits, it's really hard to break them unless you want to break the habit. But for a kid, that's all they know. This is what's right to them. This is what's wrong to them. And then you have this whole new person that's like.
Yeah. I mean, I think to kind of talk about the first question you asked her, like, you know, if I was in this situation, what would I do? How would I handle this? Could I handle this? I know that maybe this isn't like what people always want to hear, but the question I always think of, well, if it was your biological child, like, what would you just do it? Or would you be like, like I just can't do this? And sometimes there are situations where people are like, this is no longer actually like healthy for my family. And I do not, you know, feel ill will toward anyone who feels that way. That's totally fine. But I think at the end of the day, the question is like, how would I handle this? Obviously, there's some differences whenever it comes to kids in care, but, you know, it's just like, okay, if a medical emergency arises, well, I would handle it. I would take care of it.
Yes.
Or, you know, oh, this child really needs this. What would I do? I would get it for them, you know? And I think trying really hard to, ingrain a child into your life the way you would any of your own children is kind of like how that takes place. But one of the things that like I feel like we have talked about recently is whenever kids do go into homes, if it's not like this planned thing where transition and matching and meetups can take place, it's pretty instant. And I try to like tell, families, right now you're kind of a stranger to this child. Your home is strange. Your children are strange. Their school is strange. What you're cooking for dinner might be really strange to them. And it's just working every day a little bit to make those things overlap with one another. And it's not a fast process. And you have to think too, and like this is one of the things that we talked about was so many people are just essentially telling this child what to do. Go here, do this, it's just like a lot of demands that are out of their control. And sometimes they just really need space to like exist for a little while until they can kind of come back down to that like base level in order to even be able to like think straight and make decisions and know what's going on. I mean, they don't really have like a bearing of their environment for probably a little while. And they're probably viewing things through more of a survival mode versus, stabilized. So I think it's really important to understand that like in a world where they're just being told what to do all of the time, it might be important to give them, like some of that space to just be.
I think also maybe it's a fear for someone maybe getting attached to children. So what do you do in those situations to someone? Let's say they've been fostering a child for a year. What would be the longest that someone would foster where at what point do you realize it's probably going into that reunification? Like we're on that path. How do you cross those bridges? I mean, obviously someone's fostering before they know that that's the possibility, right?
Yeah.
They need to understand that needs to be agreed upon.
Yeah. I think that going off of what you said a little bit at first, it's always really important to remember that your norms are not always what's normal for the child. Like I think it was Dr. Lewis who shared that she had a child come into her home who wasn't even used to eating together at the dinner table. So she, instead of being like, no, this is what we do, you're expected to sit here with us, you let them take their space, get comfortable with your family, and slowly, if that's something that they are willing and able to do, then they will do that on their own time.
The agency essentially has, natural parents have around 12 months technically.
CYS has to file at, I think it's 12 or 15 months, and that doesn't mean that termination of parental rights will happen. Children can be in care. It's up to a judge, really. Like it's no set timeline, and it's easy to become attached to a child in your home because they're in your home and you're going to form relationships with them, and it would be concerning probably if you didn't get a little bit attached to the children in your home.
Of course, yeah.
I mean, I always try to remind foster families that anything can happen at any point. Even if I'm telling you something, I avoid conversations where it sounds like I'm certain about something happening, because anything can happen, and until it's in a court document, then we don't really know. There's a goal change hearing at some point if reunification is no longer the primary goal. So I think until that happens and you know for certain that the goal is now adoption or PLC or something along those lines, then anything can happen at any time.
I believe like at 15 months, the agency has to come up with a compelling reason why the child is still in care, but they haven't filed for termination, which can be, I think, as simple as like, there's criminal charges that are taking way longer to, administer or sentence. And they can't really move forward until that takes place. Or, mom is currently in some sort of program and she's doing really well, but she's just not there yet. That's like a compelling reason to go past that timeline. But one of the statistics that I actually got from the the information we used for National Adoption Month was that on average, a child spends about 35 months in care. So that's, you're looking at almost 3 years.
Yeah, that's a long time. A lot can happen in 3 years.
I do feel like Butler in general is really good at maintaining timelines. I think that they're totally understanding of natural parents wherever they're at. But I think as far as, making sure that they're not, harming children further, I think that they do a really good job at making sure that that's, being followed as best as they can with the best interest of the children in mind. But there are definitely places or kids who are in care far longer than that. So, I mean, this is, I think, just looking at like a national average. But still, 35 months is a long time.
Yeah, of course it is. And it's even more reason behind my past question, which it's like you can't predict the future, right? You can't predict whether or not the parents are going to. It's hard because you want people, you see it so often, and a lot of times there's so many like documentaries and films and that they this drama, right, that they use when we're talking about people's lives. We're talking about a lot of people being affected, not only just the parents, but then the extended family as well, who, again, you said kinship is if there are people who are related to those children, you do your best, your darndest. I almost said something else, to, make sure that they can stay with family. Mm-hmm. So really trying to cross off, like dot your I's and cross your T's as much as you can. So we're talking about, you have a permanency department, we've talked about permanency department versus reunification, so obviously when we talk about that, if that fails, then you're going into adoption or permanency, like legally, or a custody order. Now, what's the difference between like adoption? I guess if you have a child who doesn't have the family, right? The extended family. If it's extended family, is that the custody order, or what's that? I have these already. I have adoption, permanent legal, and custody order are the three things I wrote down.
Yeah, there's multiple goals, and I don't know if you want to talk about PLC versus adoption. I actually just recently did like a visit where that like the resource like totally focused on that.
Mm-hmm. Yeah, honestly, I'm still learning all of the differences between PLC, which is permanent legal custodianship, and adoption. In order for PLC to happen, parents' rights do not have to be terminated, and they could like later in life become involved with that child, but their caregiver, who would become their permanent legal guardian, has like all of the parental rights during that time period. And then adoption is more like permanent and final, and parents' rights would be terminated, where the foster parent or kinship parent becomes like the parent for forever.
Okay. And I do know someone who currently has a permanent legal, what was the other? Custodianship. Yeah. Yes. Yeah. They can see their child. Mm-hmm. She's a teenager now. Mm-hmm. They can see her on a regular basis, but she can never live with them. Mm-hmm. There's certain rules, right? There's just so many rules. And for a while there was a period of time where they could only have visitations, right? They were like scheduled visitations. They couldn't just show up whenever. And then it got to a point where they were able to see her and have her in their life again. And I think it's an interesting situation, because I do think that it was one of those things where they were at a point where they recognized, they actually realized. And I think this is what a lot of people don't understand in these situations. You have to feel for people if there are substances involved, right? We could go down a whole different topic, and if nobody's listened to the podcast from the beginning, like start from the beginning, because that's what I covered was, addiction in Butler County and what substances do to your brain, like to your body. Mm-hmm. And it's not a matter of just like, oh, well, get it together. That's not how it works. And to recognize why people start using substances in the first place. They're using it as a numbing mechanism most of the time for trauma, or for something that's going on with them. And sometimes there is underlying mental health issues, but when they're on the substances, they can't be properly diagnosed. So it's really hard to see families, and I'm sure you guys feel this too. And this is another thing I said to you, like, what do you do when you see a really tough case? And maybe it's something that's you're just consistently dealing with it, and you want what's best for everyone involved, right? You want the kids to go back. You want the families to be united. How do you take care of yourselves? It's not easy to say, oh, well, when you go home, just don't carry it into your house.
Yeah,
it's not that
real.
easy. That can't be a real thing. So what do you do when something is maybe keeping you up at night, or what are your coping mechanisms for yourselves?
The first thing, and I think we talked about this like whenever we first met, is just like being friends with, almost like having a relationship with my coworkers to where I have somebody else in my life who can relate to what I do. Because sometimes I'll like talk to like my friends outside of the field who like about their jobs, and not that they're less important or more important or whatever, they're just vastly different. And so I think having people to relate to in times of like really high stress, or, you know, sometimes you'll be like, yeah, working with a family and everyone's doing so great and you're so excited. And then the next day you come in and you find out that everyone's not doing great anymore and things are back to square one and now we start all over. And that is a really hard thing to hear. But somehow being able to like kind of just like discuss it like with your coworkers and like almost like definitely not make light of it, but be able to just still like talk about like your own lives and your own personal interests and things like that in a way where we understand it's like affected by these things. Like it's nice to have someone to like hash those things out with. But I guess like in my actual spare time, I like garden, crochet, make art, I don't know, things like that.
Yes.
Yeah.
Gardening.
Paint rocks.
Paint rocks.
Yeah.
Yeah.
No,
I mean,
all the things I do in my spare time are really meant to like ease the nervous system. And I think it's really, I mean, it's just like telling, like, because when you're in it, you don't realize like, you are kind of activated. You are kind of like, I got to find a home for this kid. I have to do this. I have to do that. And then there's just like a laundry list of like a million other things all the time happening. And you have to like, can't forget to tell this person this, or did I send this in an email? Like, I don't know. Like I lay awake at night and I think about like,
I'm
is
like,
this,
oh, did I ask that question?
yeah.
To that person?
Is this still in my drafts? Did this child make it to school the next day?
oh my gosh, trust me.
Yeah.
I know it.
Yeah.
I know. And it's always like the next day, then you're like, yep, I totally forgot.
Yeah.
Yes.
I think too, something that has really helped me when I first started, I feel like most people probably experience this in this field of having like the savior complex of, I want to take all of these children home with me and do all of the things that I think are right for them, but being able to transition into the mindset where it's not up to us to be the person to solve the problems, I guess, where we're there to provide support and find the resources and give advice where we can, but at the end of the day, like, it's not on me to resolve that problem. So that helps me. I think I've gotten a lot better with that, because it is really easy to just want to help every child you can, but we can only do so much.
And mentally probably take on the mental weight of that.
Yeah.
I feel like I'm similar in that sense too, where you allow all of these situations that you know are happening. Just you think about them and they weigh on you, and you're not able to just put it aside. It's that sort of, you know, you can't control what other people do. You can only control your reaction to it.
Yeah.
I'm sure it's just something that I don't know. I don't know if you both recognize like what you're doing, what you do on a daily basis is like really commendable.
We probably don't.
I know it's
And I
lot,
find the people who work in where you work with families and with adoption and fostering and mental health. I mean, you have mental health resources at Family Pathways. The people who work in the in addiction, the people who work in recovery, the people who have had lived experience, who are in the addiction world, talking about stigma or talking about the recovery and resources. I don't think you realize like how necessary you are on a daily basis and how many lives you are affecting in a positive way. So thank you for what you do, especially for Butler County, because I think for anyone out there who's struggling and whose children maybe are in the system, trust the professionals, trust the people who are providing resources for you, that they do have your best interests at heart.
I mean, I think the biggest thing that I guess like I would want to like touch on is just that like it is kind of like a national issue as far as like finding foster families. So if you've ever wondered about it, or if you've ever had thoughts about it, there is no harm in calling to just ask for information. Mm-hmm. You can come to Family Pathways and we will talk to you about it. It is not a commitment. Mm-hmm. But sometimes that little leap into, I just actually want to know what really happens versus, you know, what you hear from other people, you know, learning about it firsthand is always the best way to know information. And so if you've ever really wanted to like be curious about it and find out more information, like you can always, you know, do that. And I have the time.
Open arms.
Yeah.
Yes.
Yeah.
And we will be honest about everything. Like we said earlier, we do not want to set anybody up to fail.
No.
So we try to make it work as best we can.
Transparency. Yes.
Yeah, no, I agree. I think transparency is like the biggest thing for us. Sometimes I think families are almost like shocked whenever we're like, that's okay. And they're like, wait, aren't you like judging us? And we're like, no, like if we set you up for failure right now, we're only going to have to like figure this out a month from now. Mm-hmm. And we're not trying to set ourselves up for like failure either. Like we want as many people to be successful as possible.
Absolutely. Absolutely. That's the goal.
Yeah. Yeah.
Okay. Yeah?
Yeah.
Yep.
We're good? All right.
Cool.
Yeah.
Thank you.
Thank you for tuning in to Alter Eagle. Join me every Monday for a new episode. And be sure to click subscribe so you don't miss a single episode. Follow us on Instagram at Alter Eagle Podcast. Until next time, stay safe, stay hopeful, stay kind.